time goes on during the disease process, what can happen is those tiny channels inside the root canal system get calcified, because the nerve does have a little bit of ability to try and heal and repair itself initially, and then what happens is these little calcium deposits get laid down, and if a patient doesn't get treatment right away, these canals can literally become so tight that our files can't even penetrate or get to the tip of the root. And this was a particular case. This gentleman was 88 years old, which sometimes just in the normal process of aging, this calcification can occur anyway. But he had had a toothache, and when we got to see him and looked at the 3D scan, we were like, this is going to be a very calcified and difficult case. So in traditional root canal treatment, we gain access through the crown, and under the surgical operating microscope, we're trying to locate these canals. And this was one of those cases where you're looking and looking, and you can kind of see where they were. There was absolutely no way to get any files in. And one of the uses of the GentleWave system is to help loosen up some of these calcifications. And so while I was treating this tooth, I think I could only kind of get a little bit of a feel for one of the canals, that one of the files could just go just barely in. So decided to run the GentleWave system, and after running that and looking under the surgical operating microscope, I saw all the canals. And it was a really bizarre experience because they were clean, they were small, they were tiny, and in the old days we would have had to really kind of bore out that tooth to try and find, and maybe we wouldn't have found all of them and might have had to do surgery on the tooth. So I just told the patient, I said, you know, this is one of those cases that is very difficult, and our files wouldn't fit into this canal space. And so this was a case that was actually filled with just sealer, and got a little bit of a split on one of the canals there as well. So in other words, this was one of those cases where not one endodontic file went into this tooth, and the patient healed, was asymptomatic, and was very appreciative of us in our attempts to save this tooth. I think that's one of the future possibilities, is that we move more towards saving as much tooth structure as possible and minimally instrumenting these teeth, and letting the GentleWave system run its technology to get this clean inside of the tooth.